Assalamu alaikum. A very good evening, ladies and gentlemen. A warm welcome to yet another episode of MedTalk. Today being our 10th episode and a special on the year end. Today's topic will be on a very popular topic, which is lifestyle. I'm your host, Abdul Rahman, and topic for the day is lifestyle changes for a healthier you. A very good evening, ladies and gentlemen. To address this topic, we have amongst us a very well-renowned family physician, a senior general practitioner with over a decade service at Abeer Medical Group, currently practicing at Abeer Medical Center Azizeyyah branch. Please join me in welcoming Dr. Thaseena Sharif. Welcome, doctor.
Thank you. And I'm really happy to be here today. Assalamu alaikum to all the viewers. As we all know, our topic for today is lifestyle changes for a healthier you. Life is very simple. Why make it complicated? Don't you think?
Well, that's it's a good note to start with, a very interesting point to ponder on. Life is simple. Why make it complicated? Are we making our life so very complicated? Is the way we lead our life, our lifestyle, is it complicated? Doctor,
Yes.
is our lifestyle so very complicated today?
Yeah. Okay. Now, if we come back to say what is actually our lifestyle? Our lifestyle, what is the main definition, what we say? Lifestyle is the way which we actually live. That is along with our family, the social environment, the physical, the emotional, the psychological, everything together forms your lifestyle. So when you come to your lifestyle, there are a lot of factors actually affecting your lifestyle, and it becomes one of your style status also when it comes to showing people around you that this is your lifestyle. So there are many wrong things actually we have been doing or are doing nowadays. There are very simple changes which we can make actually to make it a little more healthier. Now, coming to the wrong, the wrong things, or we can say what we are doing wrong today, is the first important thing is the food has become so easy accessible, especially junk food. And that is, the food is its most tastiest. That is, you talk about burgers, you talk about pizzas, donuts, you talk about canned drinks, all this is very accessible. You go to any place, it's very easy to buy, very easy to carry, and you come back to your desk, sit and again eat, and you're working. So this is a very, very bad, actually, it's the way of life which we have been living. And I think most of us, depending on our stress levels and the schedule of our time, all this, it makes a lot of difference. Then even we have decreased amount, our lifestyle is mainly sedentary, that is sitting desk jobs, which are normally, most of the people are doing. There are few people who have outdoor jobs, but still that also going around, taking in something which is easy to accessible, eat and drink. Then very sedentary type of lifestyle. The third one is smoking, which we normally see. Not only which we seeing as smoking as in cigarettes and all that, the new style statement is vapes, which we have heard about, the shisha, which is normally very common here. All it is very actually very unhealthy for our personal life. Then if you talk about actually when you finish your work and you're going back home and you're sitting down to relax, what do we normally do? The best and easiest way to relax, take back your phone, open your laptop, check your status. So this all is actually you're plugging in, you're not giving yourself time, or you're not giving yourself the energy to recharge for what you have to actually do. So these are the major differences, some major problems which we can, it's very easy, very easy if we change our little bit of lifestyle to come over these things, and these may be a leading cause for many diseases, which is very common, which we are seeing today.
Right. So when you rightly pointed, so now we try to understand, how our lifestyle is getting complicated, and because of which we are prone to many lifestyle diseases. Now, this term lifestyle disease is a combination of many diseases, right?
Yes.
So we would like to know more about it. Now, what are we talking? What is a lifestyle disease form?
See, lifestyle disease, because of your wrong lifestyle, or because what you're doing wrong, it may be leading to certain diseases. The first and foremost thing for a lifestyle disease, it comes to obesity. We come to obesity. From obesity, there may be a number of diseases because of obesity which may lead to, like type 2 diabetes, hypertension, hyperlipidemia, this is the same thing, hypercholesteremia, and this may leading to many cardiac diseases. Medically, I mean, like we have something called metabolic syndrome, which is a combined thing of all this, along with obesity and your hypertension and your diabetes and hypercholesteremia. This together forms a different syndrome itself in our medical science, that is called as metabolic syndrome, which if it's just with diet and exercise can be treated. You may not be requiring medications if you change your lifestyle altogether. See, along with these major diseases which I told, we have other diseases also, like we have a lot of fat accumulating in the liver, that is causing fatty liver, then that causing gallstones, then skin infections, skin diseases which are there, the respiratory diseases which are there, asthma and lung diseases which we see. So, I mean, these all are conclusive of what we are living today, the way we are living today.
If I understand it right, I think a primary cause of any form of lifestyle disease, I think everything starts with obesity.
Yes.
Right? That is a leading factor to almost all the lifestyle disease formats.
Yes, majorly.
Yeah. So, what exactly, for the benefit of the viewers, if you can shed light on obesity. As before you head to the topic, I just want to remind the viewers, we are taking in questions. If you have any queries related to lifestyle, the lifestyle diseases, how to curtail them by making certain alterations or changes to your current format, do share us your queries, and we'll be more than happy to address them. Now, moving on to the question, obesity, okay, a leading cause of lifestyle disease.
Yes.
Right. So, if you can, let the viewers know, how is obesity and lifestyle diseases interrelated?
Okay. Now, when we talk about obesity, what is actually the definition of obesity? What is obesity? Obesity is the excess accumulation of fat in our body which leads to certain diseases. That is either because of not eating healthy or not using up what you are eating. That is the amount of your putting in calories, you are not using that, and that is not exercising. So, that makes that grow as fat. So, when that becomes fat, excess amount of fat in the body, that is actually obesity, which is not necessary for you. Then in obesity can be actually measured. Or first we'll go into the classifications. When you go into the classifications, we have the normal BMI levels, then we have people who are overweight, then it comes obesity, and then we have morbid obesity. Now, how do you actually check this is with the BMI. What is BMI? BMI is body mass index. How do we calculate BMI? BMI is calculated with simple things which can be done even at home or even in the presence of your doctor or the physician, whichever you visit. When you start talking about BMI, that is the weight in kgs of the person divided by the height of the person in meters squared. Now, when you have a reading of 18.5 to 24.9, that is a normal BMI. Even, I mean, if you come to 25, when you calculate it, if you say 25, sometimes it will come out as overweight. So, when the reading comes from 25 to approximately 29.9, that when the person is overweight, and then from 30 and above it becomes obesity. But when it reaches 40 and more, then it's morbid obesity. Morbid obesity is like a ticking time bomb, where you have to see to that you're taking care about yourself. You have to know what you're doing, what you're not doing right, because these will lead to major diseases like type 2 diabetes and any cardiovascular diseases, which you're very prone for that. This is one way of measuring. But see, BMI cannot be the whole way which I can tell you this is the only way of measuring fat. No, because in BMI also there are restrictions, like we cannot calculate BMI for a pregnant lady. The BMI is not calculated for athletes, for muscle builders and all that, because their muscle weight will be more than the fat, because we are actually just calculating an average reading. So, when you are calculating for, say, a simple thing of a weightlifter or something, when you calculate, maybe that person might come out obese, but actually he is not. So, there are restrictions also, but that can be cleared out with your dietitian or with your nutritionist or even your doctor. Then the second way of measuring your weight, which we normally do, is the waist-hip ratio. This is the circumference of the narrowest part of your waist with the circumference of your hips. For females, the ratio of these two should be less than 0.7 to 0.8. For males, it is 0.8 to 0.9. A reading which is 1 or greater than 1 again is a ticking time bomb. You have to take care, because this is again leading to type 2 diabetes as well as for your cardiac diseases. This is just a way of measuring. How this is a general way of just measuring how to. And when you're talking about waist hip ratio, the most important thing we are actually measuring is the visceral fat. when you're measuring your waist and your hips, the basic thing which you cover is your circumference of your tummy. That is when you're normally, when the tummy goes on becoming bigger, I mean for whether it may be males or females, that means to say you're becoming more prone for type 2 diabetes and for any cardiac diseases. So you have to take care that you do a little bit of exercise. As soon as you get to know all this, you have to see that you're taking care of your health.
Perfect. Doctor, I think as we were discussing this topic, we had just received a question from Shabna. Hope, Shabna, your question has been answered. Her question was, what is BMI? So, doctor in detail mentioned about what is BMI, and now doctor has given us a target to be having a very normal body mass index. We must be aiming at less than 25 units of BMI, which is a ratio between your weight in kgs by height in meters square. So if you can maybe do it on a monthly basis or maybe bi-weekly basis, measure yourself and let's target to achieve a target of say 25 or less to be normal BMI, so that our lifestyle diseases are taken care of. Having said that, now obesity, again coming back to obesity.
Yes.
What is the causes of obesity apart from overeating, which is the major cause, but there could be other causes as well,
definitely.
right? So what is the
there are a lot of causes actually.
Yeah.
When you see there are a number of causes when it comes to obesity. The first major cause being genetics, that is in our genes. Now normally we know that okay, my mommy and daddy are a little on the overweight side or obese, so I am going to be. But that is actually not the criteria. No, definitely the gene of obesity, I mean that gene for you becoming obese is definitely there, but not necessarily. If you're taking care of your health, if you're taking a proper diet, a proper lifestyle, not necessarily that you have to become obese. See, there is changes in the metabolism which normally take place. There are people who eat more and don't become fat. There are people who eat little and become fat. Absolutely. This all comes in your metabolism, and this is through your genes.
Right.
So this we cannot change, but yeah, definitely yes, we can change according to our lifestyle and a proper diet and exercise. This is the most important. The key thing for all this is your diet and lifestyle modifications. The second thing which comes to hormones. Now hormones, like if you're taking out your thyroid hormones, a patient or a person who's having underactive thyroid or the thyroid not functioning properly, a TSH levels not being growth hormones not functioning properly, there might be changes again in the weight because of their hormones. But for this also, the most important thing, consult your doctor, talk to your doctor, that is the most thing. Then there are medications. There are medications which tend to increase the weight, like contraceptive pills are there. Then antipsychotic drugs are there. Drugs treated for asthma, like you have your steroids. All these also tend to increase the weight of the patient. But the same thing, the repeated thing is that is whatever your condition may be, the condition is treatable, and with that you have to consult your doctor before changing your medication or starting off on any medication. Or you cannot stop your medication just saying that okay, I'm going to put on weight, so I'm going to stop the medicine. No, that's a very wrong decision. You have to consult your doctor, you have to talk to your doctor, discuss with your doctor, get educated with what you have to do, and definitely that will be settled. Then the next thing which comes is inactivity, the sedentary lifestyle, which I already told. Sedentary lifestyle, the type of work which we do. See, directly actually the number of hours of sitting is directly proportional to the amount of weight gain, which we don't even think. Right. You're sitting on your couch, you're sitting in the office, you're sitting in, basically we're not standing. So it is advisable, I mean like 1 hour in between 1 hour, you see to that you just stand up, walk around, just move a bit. So automatically these will tend to increase your metabolism. Right. These are along with this, and again the food habits which come up. The easiest and the most accessible foods, the junk foods, and even the processed foods actually, which we can talk about is now the whole wheat, now we have to just substitute when you're talking about foods also. Taking in maida, that is the white flour or refined flour which we normally call. These all are things which we have to be a little conscious when you're buying. I mean when you start looking at the labels, when you start seeing the calories of the amount of calories which the food is there, so this will automatically definitely help you to choose the right kind of food. So this will help you to prevent again, that is when you start off with this. Like these are the major causes which we normally see when you are talking about thing. So and along with this, I think even smoking. Now when we talk about smoking, see smoking itself is bad. As soon as you put a cigarette in your mouth, that it decreases the oxygen supply to both your blood vessels as well as to your heart. So just imagine how dangerous it is. Then the second thing is that your lungs are directly affected, your body gets directly affected with the nicotine and along with the chemicals which are present. Now the thing that some people which I have seen as patients also, they come and tell me, no, we are just putting on weight because we stopped smoking.
Okay.
So yeah, there is a factor that when you stop smoking, you tend to put on weight, but you have to move that energy into the positive level. That is, you start doing exercise, you start doing something which in that way it's a positive way, which you do not start tending to putting on weight. And then psychologically, what happens is this sort of patient, what you start going towards food. I mean, like a chewing gum, we'll eat this, we'll eat that. So that what happens is you're trying to cut one bad habit and then you're putting on to another. So the most important thing is you have to just take care, get educated of what you have to do, and with that automatically things will start working out.
Right. If you have to just summarize,
lack of sleep. When we talk about sleep also, either when a person, you see the normal quantity of sleep which we normally require is about we say about I think 8 to 10 hours of sleep, at least around 6 to 8 hours of sleep, which is normal. But when a person is not sleeping, I mean, like either you have lack of sleep or a person is sleeping for too much, again we have hormonal problems which take place. So that itself again will cause weight issues, weight gains actually.
Doctor, as we speak, I just want to quickly summarize this answer of yours. I recently read somewhere where it says sitting is the new smoking. Yes. Okay, and I think the take home from this answer would be get active. The
most important thing actually.
The right way to go about fighting obesity is to get active. Okay, yes. And and of course fight the other lifestyle diseases. It's good to see we getting a lot of queries, a lot of questions coming our way from our viewers. We highly appreciate it. We'll try and answer almost all your questions if time permits. So can I take a related question? Yes, okay, this is from 𝐓𝐸𝐻𝐿. He says, can obesity shorten life expectancy?
Definitely yes. Definitely the answer for that is yes, because as a related, I mean medically, and there are talks, and plus along with that related thing, that life expectancy is directly related to increasing your, when you start exercising, it increases your life expectancy. So automatically when you're becoming obese or when you're putting on or increasing your weight, then definitely your life expectancy decreases, because you're making yourself prone to diseases. This is basically what life is actually. This is in our hands. What you want to do or you don't want to do. You know what is right, you know what is wrong. It is your choice. I mean health is the most important thing in our life, and this is the most precious gift what Allah subhanahu wa ta'ala has given us. So we have to value that, and even in the Quran it is written that you have to value your body, you have to value yourself. And this is a way which again when you have to return back your body to Him, it should be in a proper shape, in a proper way, that when you are returning it back to Him, even He should be happy.
Absolutely.
I mean, these are some personal, I think, things. Once you take it in a positive note, once you take it in a way where it is healthy for you. See, because there are so many reasons for a person becoming obese. The other major factor also being stress. Stress itself causes people to start eating, indulging in food. I mean, a feeling of very unhappy, feeling of unhappy. Then you're in so much of guilt that you just turn back to food, or there might be a loss of any family member, loss of a closed one. So you don't know how to express yourself, or you don't know how to express, who to express.
Right.
So what do? You turn to food, and so that in turn, what happens again? You start becoming overweight, you start becoming fat without actually realizing.
Right.
Stress is one major factor, I mean, which really rules the major cause when you're saying about your lifestyle.
𝐓𝐸𝐻𝐿, hope that answers your question. I think he's following up with another question. I think that the doctor's already answered. I think we will I'll take the question anyways. He talks about what are the steps people can take, both kids and adults, to break unhealthy habits that lead to obesity.
See, that we'll go on a little later in the show, at the part of the show. I think that when it comes to
doctor will get into detail, but I might want to summarize in 2 words. It's get active. That's the easiest
it's
said.
Definitely, yes,
it's just the easiest said. Yeah. Answer. Now I have a few more questions. It says about how can I lower my BP during pregnancy. I think it's more of a pregnancy related question.
Pregnancy. See, there are, first of all, the most important thing is salt intake. The moment you know that your firstly the weight of it, definitely you have to consult your gynecologist. Your gynecologist is the best person to answer that question, because she will tell you whether your weight is in an excess rate where you're increasing your weight in a very abnormal fashion, or maybe the baby weight, or maybe your own weight. And then after that, and the food, you have to see that you're taking a salt restricted diet, drink lot of water. All this is very, very helpful for you. And the medications, depending on how much your BP is. See, when you go to classification of BP, it is normally that the BP should be less than 120/80 for a normal. A little elevated BP, when you say, it will be 130/90, and then after that there is there is grade stages of hypertension, that is stage 1, stage 2, stage 3, that is depending on your BP, that is 140/90, 160/90, and hypertensive crisis. So the best thing is for you to do is to monitor with your gynecologist, and if necessary your gynecologist will definitely start you on a medication which is healthy for you as well as for the baby.
Right. So there is one question coming away from Naveed Ahmed. It is again talking on diet. Naveed Ahmed asks a very simple question, and I'm sure most of our viewers will have this question. Doctor, this question is for you. It says, what do you suggest in diet to live a healthier life?
See, that is also when I start off, when we come to the preventive measures, is a simple thing called as my plate. So which we will again talk in thing, that is how much portions of what all you should eat if you have, regarding your proteins, regarding your fats, and regarding your veggies, your fruits. This is inclusive of your children as well as for the adults, and the amount of dietary products and all you should take. That is as per, I cannot label a specified diet for any person.
Absolutely.
This is as per your body requirement. That I cannot tell you that no, see, this is your body is short of that. You have to, if you want to exactly know your thing, you have to either go to a dietitian or a nutritionist, because he will be the best person to advise you in what you have decreased and what you have to supposed to take. Because when you talk about a diet, it is mixed with all. It is not, we normally see, previously we had something called as the diet pyramid. It was the diet thing. Now it has become a plate. The diet plate, that is where when all the portions of meals are equally divided, which gives a healthy lifestyle.
Right. See, as doctor said, there cannot be a standard diet plan for anybody.
Yeah.
Each one has a certain requirement, and that needs to be planned in consultation with the dietitian. There are many crash diets that people follow.
Yeah, that is when you're talking about diets, like if you say, I'm not going to specify that, because it will become a controversy because we like or don't like. See, normal, when you say a 21-day diet plan is a habit, a 90-day is a lifestyle.
Absolutely.
When you follow a 21 days, it's just a habit. You're trying to inculcate the habit, because there are a lot of talks, a thing about reversing your diabetes, reversing your diseases, and it's true, it does definitely happen. But the most important thing is you have to be consistent.
Absolutely.
The main thing for all this is consistency.
See, as doctor said, crash diets cannot be an option, because you need to adopt diets which you can lead a lifestyle,
yes,
the rest of your life with. So that should be a
none
pattern.
None of the diets which are which you get on the net or which you are taking on YouTube, anything, they will never advise you to follow the diet continuously. They will tell you give a break or give a gap at least for some time, or they will tell you, no, you follow this for 14 days, you follow this for 1 month, and then give a gap of 1 week or give a gap of 2 days. The reason for this is what? Because this cannot become your lifestyle. Now what we want is to change the lifestyle totally altogether. This is not for today, this is as the years go by, this is for a proper healthy living, because health cannot be compensated in any form. In any form, health cannot be compensated. And what you do, the same thing your children will learn. If you're eating healthy, if you're eating right, if you're exercising properly, see, children normally, whatever if you see, that is it's easier for them is seeing and learning more than trying to teach them, to tell them, no, you eat this, you eat that. But if you're doing it in front of them, you don't even need to tell them that.
Absolutely.
Because when they see you doing that, they will do the same thing. The same thing, it comes up even with your mobile phones. People, we as adults, we don't realize the number of hours we spend on the mobile. We are busy with the mobiles. Maybe it is our work, maybe our bread butter, but still, this is not something healthy. You should have family time. You should have a recreation time with your family. You should spend time with people talking, not on the mobile. Because see, communication, social media, you get up even in the late, in the midnight and you check, still people will be online.
Absolutely.
So that is not the way of lifestyle. No? You have to sleep. See, Allah has made the day, the night, everything in a format. In what way? We should follow
Absolutely.
that. And once you follow this, definitely you will be disease free.
Perfect. See, there is this one question which is now come in, an interesting one, I must say. It's from Muhammad Haj. He has there's a trend, which is fast catching up. People are finding alternatives, okay, to certain bad habits, okay, smoking, right?
Yes.
Now they're talking about, they feel electronic cigarettes.
Yeah,
okay,
that is what
that's
I
a perception.
specify.
There's a perception today that electronic cigarettes are safe, right? Now there's a question Muhammad Haj asks, is electronic cigarettes safe? Today, what has been observed is even the youngsters, schoolgoers, are getting into this habit.
See, that is what when I commented
pace,
on. That is what when I commented on vapes. No?
Yeah.
That is the thing which is a trend which is going on. You put color, you put a thing. This is just
it
for
seems
the
to be
style.
fun, but
yeah, it is just for the heck of it. But for the health, just imagine how much of pressure you're putting in, how much of your oxygen supply is coming down, how much your brain is getting so much, because you just want to prove to someone else, and which is not healthy. You tell them to do 10 push-ups, you tell them to do 15. Put these as challenges.
Absolutely.
Because these are healthy lifestyle changes. I mean, which we see, okay, you do that many push-ups and show. These are something which the kids should actually be pushed for. But this is actually not the trend which is actually going on now. It is the main thing is you go in for the easier way. I mean, like easier way.
And looks more fun than the usual. And this is unfortunately a habit that is catching up very fast amongst youngsters, especially schoolgoers and the young college goers. Something we need to be aware of, and the parents and the people, the guardians have to take care of and curtail this habit at the initial stage itself. Moving on, Doctor, there are more questions coming our way, which is maybe related. I don't know how relevant is it for today's topic, but anyways, I just put it across since one of the viewers are asking. We appreciate your questions. We look forward to more queries from your side. We'll try and answer as many as possible. One question which has come from Mr. Ajmal. He asks, what is anxiety attack? What is the reason for this to occur? Is it anyway related to today's topic?
See, when we talk about stress, the same thing. When I'm talking about stress, stress is what either it will come out in mood swings, or in the form of depression, or in the form of anxiety. Now, the first important thing, what happens to your body? Now you're stressed out. What happens immediately? There is a rise of hormone levels. There is a lot of adrenaline and corticosteroids which take place in your body. Suddenly it increases your heart rate. There is increase in your blood pressure. Automatically, as a person, you really don't know what is happening inside of you. But everywhere and anywhere, the body always tells you what is happening. So like if you're saying you're anxious in what way? Anxious for a particular reason. There might be something which is going on which you're not comfortable with. You're not very happy with what is going around, or you've lost on something. So you have to actually catch the cause more than just telling me that no, you're becoming anxious. Anxious for what? So once you treat the cause, then the anxiety itself goes. No? Yeah. And plus there are medications. I mean, see, there are people maybe that they might not be able to control yourself. See, the best thing for this is actually yoga and meditation. If you actually see, when there are therapies and ways where you can actually tell the person or explain to the person what to do in that particular type of an attack. So I think with that, the person will be able to handle that stress or handle that anxiety in a more cool, in a more methodical form than just getting hyper about it.
There's one more question which is coming. Ajmal, hope this answers your query. Coming to another question, I don't know, since it is with food, I think it might be related. It says, is there any food which ignites early morning cold? Is there anything like that?
Early morning cold, see, not necessarily, but maybe something like the cold, or maybe your body might be allergic, like if you're taking enough lemons or citrus fruits or something like that. See, each person's body acts in a different way. We can never say that something which may be very normal for me, maybe something which may be a little bit allergic to you, or maybe that might be causing. Like simple thing is air conditioners. There are people who are very comfortable with air conditioners. I mean, we use it day in and day out. But there are people who are really like you come in from a heat and get into the room, and then suddenly you start sneezing and you're so uncomfortable with it. It may be just an allergic thing. So you have to get to know what you've eaten that is triggering the factor. Once you get to know that, then I think that question should be answered
by yourself.
the person itself.
So because you need to backtrack and see what you ate the last night, and then maybe investigate.
Because that
anyways, that
automatically answer.
That is a good query asked. We tried our way of answering, but anyways, thank you, Sabah, for the question asked. So investigate yourself, see what have you eaten the last night, and then check out.
Normally the resolutions are smart, meant to be broken.
As Dr. rightly says, resolutions are meant to be broken.
But when actually in this also it is that when you make a resolution, see, if you want to stick to your resolution, you don't have to have 10 reasons. It is just one reason. Why you have to stick to that reason? That may be something personal, that may be something so sensitive that that thing will trigger you. Right. You don't need anyone to back up, you don't need anyone to stand up. But that one thing, hold on. There, I mean, I think in cartoons and all that, there was a hold on to Tinkerbell, I think. So hold on to your thoughts. So that is something which I think personally, you have to hold on to something which is very, very important, and then you grow towards it. You automatically 100% will go towards your goal. I mean, this is personal, because when it comes to resolutions, they may be, I will not smoke, I will not eat, I will not. There are many resolutions which are made. But for personally, for making a resolution and seeing that you go forward with it, you have to hold on to the thought. One single thought is more than enough.
Perfect. So if you can reach or say achieve that one thought, I think you're a great achiever, and then maybe put up the next thought up front. Yeah. Now
and one more thing, you see, when you're taking up any resolution or when you're taking up anything, do it in small steps.
Absolutely.
Never try to make it in such a way that when you tell, okay, I want to, I mean, you're talking about, because the most common resolution which we normally see is weight loss. We'll say, okay, no, I'm going to lose weight, I'm going to do this. So when you're doing weight loss, don't think about 5 kgs. Don't even think. Just think, okay, 1 week I will lose only 1 kg, not more than 1 kg. And it is possible, 100% it is possible if you're sticking to your resolution, if you're sticking to your self-will, you're making yourself motivated, and you see to that. And see, once you stand on the scale, automatically you are the person who's going to be the most happiest, because this is something, you know, what you have worked for. And 1 kg at a time, definitely it works. It definitely works.
So short steps, we will lead to a better goal. Now, coming to the today's topic, which is lifestyle changes for a healthier you. So we have learnt about what are we doing wrong and what we need to do. Now, most importantly, let's get into the crux of today's topic. That is, what are the lifestyle changes that one has to incorporate considering today's way of living?
See, the first thing what we have been repeatedly telling now is diet and exercise. Now, when you talk about diet, I told you regarding the plate. When you talk about my plate, there is portions. There is portions of vegetables, there is a portion of fruit, there is a portion of whole wheat grain food. There is always brown is always better than white. And the other thing is when we're talking about meat, that is when you're talking about red meat or fish or chicken. See, white meat always better than red meat, but if you're taking in of fish, always more portions of at least 2 servings of fish in the week is very good for your omega-3. We have salmon, tuna, these are very high in omega-3. So this you can incorporate, and a glass of milk or yogurt. This makes a complete diet, but this balanced diet may be in different portions depending on your weight and depending on your lifestyle. So you have to choose your thing, what to eat in a particular thing. And the most important thing when you're taking about a plate is the size of the plate. The portion control here is the most important thing when you're doing any diet. You have to see that you're doing in portions. Try to avoid buffets, because in buffets it is open food. You don't know how much to eat. You don't know how much you're eating. You take a plate, I mean, like normally, you know, when you go to any parties or anything, you see the plate is overfull.
You ensure you take everything of the buffet.
You want to taste each and everything,
Yeah.
but you know what, when you're eating, you don't know how much you're eating.
Absolutely.
So that is the most important thing which you have to take care when you're doing your diet. When now this is regarding which we're talking about your diet. When you're talking about exercise, as per the 𝐓𝐸𝐞𝐿 thing, you have to, that is American Diabetic Association, you have to see that at least minimum of 30 minutes of walk 5 days a week. That is approximately around 150 minutes of walk, 150 minutes of walk per week. In this walk, maybe we normally, this is very clearly stated that moderate, in moderate intensity. Moderate intensity means what? That is you walk, that is your walking. It is not your, now I see a lot of people say, no, we are walking. We went to the mall and we walked. We went for shopping and we walked. No, that is not called walking. When you walk, you just walk. That is, you start off with slow. Never try to, I mean, if you're doing any sort of physical activity, you try as much as possible to go in slow steps. Start off with the 15 minutes if you're doing a treadmill. Start off with 15 minutes in which you're most comfortable with. Don't try to go in for an exercise, or don't try to just because someone else is doing, because you should know what is suiting you. Aerobic activity is there, swimming is there, then physical activity, any form of dance form. I mean, there are a lot of aerobic activities, and now even here that the gym being open even for the females, I have a lot of patients who have joined the gym and are really feeling very healthy. Especially this is very important for the older age group. You know, when people are becoming, as you grow older, you don't know what to do. At that time, you know, if there is company, you always feel very healthy when you are doing it in a group and you're not left out. I had a patient coming and telling me, no, if I go into the pool, all the water will come out. No, it's a very normal thing. It's not something, I mean, like, you know what, this is a fear what that lady has had. So this thing we should overcome this, you know, and this is only with the support of family members, a support where you know that you're telling them, no, we are going to push you little and you can do it. Just those 2 little words of standing by and saying, no, you can do it and we are there with you, we are supporting you and nothing is going wrong. With all these, see, even pains in your joints, for older patients I'm talking about, for osteoarthritis, all these factors, you know, once you just start an exercise which is comfortable for you, this will work, 100% it will work. But everything in a positive way, always positive energy. The most important thing when you have positive energy, positive feedback. That is very important.
So that, I think that was one of the questions that came my way. That is from Shabna Muzammil, who just asked the question which she just answered, which is on how much hours of exercise we should be doing.
No, that is 30 minutes if you say
can
5
start
days
slow.
in the week. Yeah, but always start slow. Yeah. Never try to do 45 minutes the first day and then after the whole week then you cannot do because your leg is cramping, I'm not being able to do. Posture when you're doing exercise is very important. Shoes are very important because sometimes it is not considered, but these are these are very important factors when you start walking and things, because then you're making yourself prepared. Once you make yourself prepared, then you can walk. It is just with small steps, but you will manage your goal.
I think well said, doctor. But coming to another question, I think we might be repeating this, but again, for the benefit of those viewers who joined us late, this is a question from Takia Sharif. She asks, is there any way to reduce stress? This is the most, I think that is another leading factor today. Yeah,
the most important thing. See, that's the first thing which I told you, that the first thing is stress. Why stress is coming? There is when you have stress, there is a backup for the stress also. No, there is one thing, that is either you have your studies or you have some family problems, or there is one particular thing which you have to work up on. So that is a main factor. Now, once you think that is a problem, it is a big problem. Now, when I tell you that, no, okay, if I tell you losing weight is a problem, and I'm not trying to get up to just put one foot forward and say that, no, I'm going to start. Once I start, I will see. So once you start with your goal, then you will automatically lose. So this is the same thing for stress also. The easiest is, one is you read your prayers properly, you meditate, you ask Allah to help you. These all are very positive things which come up, you know, and then automatically once you are happy from inside, the stress factor definitely comes down.
There's one, it's more of a medically related question. I think it's come off on the WhatsApp group. It says that what are the possible way to reduce fatty liver?
See, what is fatty liver? Fatty liver is the liver, that is, there's accumulation of fat on the liver. There are different grades of fatty liver also, but we cannot go into detail of that. But the main basic thing of reducing fatty liver, again, That is the cholesterols and the thing. Once you start with your diet and exercise, the most important thing is your, again, physical activity, eating right, then seeing to that you're not going in for the very fatty foods. All this definitely will start reducing, because see, for all this we don't want to go in for medications immediately, depending the person whoever has asked this, because I don't know the age, I don't know if there's any risk factors, I don't know if you're diabetic, I don't know if you're hypertensive.
Might want to visit.
So you have to see to that you come visit, and your total profile should be known for me to answer a question. I mean, in the way in which you are expecting, because generally, this is related to your obesity.
Okay, doctor, if you have to summarize today's topic, which is lifestyle changes for a healthier you, what would be the take-home message for our dear viewers who have been with us throughout today? And we thank you so much. But as a take-home message for the viewers, doctor.
See, the first most important is eat right, eat healthy, exercise properly, meditate. See to that you're not taking in so much of stress. Be positive, be happy. This is the only thing which I can tell, because if you summarize everything, is that a positive mood if a person have, that becomes to a positive note altogether. I mean, and that for your healthy lifestyle. Most important, be healthy. That is the most important thing.
Thank you, doctor. Now, it has been a very informative session. We would like to thank Dr. Thaseena for this, the time spent and so much of knowledge, and most importantly, we also would like to thank each and every viewer who's been with us throughout the last half an hour plus. We've been on for the last 45 minutes, and we thank each one of you, and thank you very much for all your queries, questions. You can still continue to message us on our inbox. We will definitely be more than happy to answer you. Doctor will personally answer your queries on the inboxes here. But before we close, I would like to summarize this today's MedTalk by one of the viewers, who's actually come out with this thought, which says, consistency is an important element. In lifestyle correction.
Yes, definitely.
So I think consistency is the key.
That is the most important thing.
So we got to be consistent in whatever we do to have better results. Thank you, Ms. Fatin, for that message, and we appreciate it. And as simply put, this is where we have to live. That's your own life, and we got to take care of it.
Yes.
So once again, we started off with a quote by doctor, which says, "Life is simple. Why make it complicated?" Please take care of your health, and wish you a healthy new year, and may all prosperity and good health and blessings of Almighty be with you always. Thank you very much, viewers. Thank you, doctor.
Thank you so
for being
much
with us. Inshallah, see you again on the next MedTalk next week, same time. Inshallah. Thank you.